to the debate. If you were handed a check for $9 million to stop an emergency happening right outside your front door, how long would you wait to spend it?
I mean, not very long, right? You'd spend it immediately.
Exactly. Well, that's what a lot of people think. But here in Lexington, Kentucky, that isn't just some hypothetical question. The city is sitting on roughly $9 million in national opioid settlement money right now.
Yeah, and the community is deeply, deeply divided on how to actually deploy it.
Right. So following the highly anticipated Urban County Council budget discussions, the ones that just kicked off at the Tuesday, April 21 work session, we are analyzing Mayor Linda Gorton's proposed $546 million general fund budget.
It's a massive budget.
It is. But the item drawing the sharpest scrutiny isn't, standard municipal spending. It's the $30 million that Fayette County expects to receive over the next 18 years from these national opioid settlements.
Right, and the city has held that first $9 million since 2022 and literally hasn't spent a single dollar yet.
Which brings us to the central disagreement emerging from Tuesday's work session. The core question is this: should Lexington prioritize long-term sustainable infrastructure by placing millions into an endowment-style account, or does the sheer urgency of the opioid crisis demand the immediate deployment of these funds to grassroots organizations right now?
Which is exactly what we're tackling today.
Yep. And I will be arguing for the mayor's deliberate, sustainability-focused approach to building generational infrastructure.
And I will be arguing for the urgent, immediate disbursements of these funds. We need to get this money to the grassroots organizations out on the streets combating this crisis today.
Okay, so to grasp the mayor's approach, we really have to look at the mechanics of municipal governance, right? And public health infrastructure. Lexington's current proposed plan, which is placing $3 million into an interest-bearing account and dedicating $2.2 million to supportive housing.
And creating that structured grant process, yeah?
Exactly. That is the most responsible way to handle finite settlement dollars. We know this deliberate approach works because, well, we can look at the proven success of the city's existing infrastructure.
Okay, but...
Wait, just let me set this up. Back in 2018, Lexington created a single overdose prevention project coordinator position, just one administrative role. And that has systematically grown into a 13-person community paramedicine team.
And look, nobody disputes that the paramedicine team does phenomenal work. They are incredible. But we have to look at...
Let me just finish the thought on the data, because the results of that structured system are staggering. That grant-funded team helped drive a 43% decline in fatal overdoses in Fayette County.
43%?
Right. We dropped from 210 deaths in 2022 down to 120 in 2024. Because our current systems are demonstrably working, the city has earned the breathing room, essentially, to carefully build a sustainable, long-term safety net with this new settlement money.
Breathing room.
Yeah, rather than rushing it out the door without a framework.
Okay, that 43% drop is an improvement, absolutely. But breathing room? Holding $9 million in the bank for years while 120 Fayette County residents still die annually it's a profound failure of public policy.
I think failure is a bit strong.
It's not, though. 120 human beings dying is a catastrophic crisis. It is not an invitation to relax. I want to draw your attention to the perspective of VOKYK organizer Trevor Davis.
He spoke at the budget hearing, right?
He did, and he spoke incredibly powerfully. He highlighted the brutal reality on the ground right now. People are currently sleeping on floors. They are pushed to the absolute margins of society, and they desperately need immediate wraparound services, syringe programs, drug checking right this second.
But Trevor Davis's urgency, while I completely understand it, it ignores the reality of how these funds physically work over time. If we drain the account to get everyone off the floor tonight, what happens to them next month?
What happens is they are alive to see next month.
Well,
no, seriously, that is the baseline we are fighting for here. The city's proposed tiered grant system for nonprofits is just far too slow. It's too bureaucratic and it is heavily gated.
It has to have rules.
But we have to remember what this money is. These settlement funds are essentially blood money. It was extracted from the corporations that caused this epidemic in the first place. It must be urgently injected into the grassroots, neighborhood-focused organizations that are literally keeping people alive today.
I hear you, but
It shouldn't be locked away in a municipal trust fund for a rainy day. It is pouring right now.
Okay, but let's look at the forecast for that rain. During the Tuesday committee meeting, Commissioner of Social Services Casey Allen Bryant made a vital point about financial prudence that we honestly just cannot ignore.
About the payouts?
Yes, she noted that these settlement payouts are highly unpredictable. We're talking about money coming from incredibly complex national bankruptcies, multi-state distributor settlements, ongoing litigation.
Sure.
We literally do not know exactly when the next check will clear or exactly how much it will be. She said explicitly to the council, we don't want to bankrupt our account. By establishing an endowment-style framework, the city ensures that funding for opioid response is insulated from those legal fluctuations for the next 2 decades.
Unpredictable? Sure, I'll give you that, but I just don't buy that framework when we look at the fragility of our current safety net. You mentioned the community paramedicine team earlier.
Yeah, they're fantastic.
They are. They're out there doing the follow-ups, connecting survivors to resources, but how are they funded?
Well, mostly federal grants.
Primarily by federal grants, exactly. And as we've seen in recent news reports, federal funding for community paramedicine is actively threatened right now.
Which is why we need an endowment.
But what happens if those federal grants dry up while Lexington is sitting on $9 million waiting for interest to accrue? Vice Mayor Dan Wu captured the frustration perfectly at the work session. He pointed out that nonprofit partners are constantly asking the council, where is this money? How come it's not being spent yet? We are treating this like a generic pension fund rather than an emergency triage fund.
Let me ask you this, though. If we treat this settlement like a single paycheck, right, and we spend it all on immediate triage, sending out ambulances, as it were, aren't we neglecting to build the hospital we'll need for the next 10 years?
If the patients bleed out in the street today, the hospital you build in 10 years is going to be completely empty.
That is the fundamental tension here. First District Council member Tyler Morton emphasized this exact dynamic at the Tuesday work session. He wants these funds invested directly into the people through innovative solutions, specifically focusing on grassroots, neighborhood-focused organizations. Because these smaller groups are the ones actually reaching the marginalized populations.
And I agree those groups do vital work. I really do. But they lack the infrastructure to handle millions in municipal funding responsibly.
Because they are exactly the kinds of organizations that get locked out when a city demands rigid, bureaucratic, tiered macro grant compliance. Do you know what macro grant compliance actually looks like for a small community group?
It means proving you can handle public money.
And sitting through months of municipal review. Grassroots groups don't have grant writers on retainer. They have people out distributing Narcan from the trunk of their cars at 2 a.m.
I get that it's difficult, but those compliance measures aren't just red tape, you know? They exist for a reason. Let's look at the institutional infrastructure actually required to heal a community.
Okay.
There was a recent comprehensive capstone study from the University of Kentucky's Martin School of Public Policy. It was published on UKnowledge, and it analyzed Fayette County's recovery housing landscape. The study revealed severe gaps in our formal recovery infrastructure.
Specifically regarding what?
Specifically regarding the disclosure of certifications and the availability of medications for opioid use disorder, or MOOD. The mayor's strategy aligns with utilizing these funds deliberately to achieve state recovery-ready community certification.
But what does that certification actually require of the people trying to provide beds? Because that's the issue.
Well, it requires that recovery homes meet strict NARES standards, that's the National Alliance for Recovery Residences, or Oxford House standards. And that is crucial. NARES standards aren't just bureaucratic hurdles.
They kind of are, though.
No, they're the mechanism that ensures a recovery house actually has medical oversight, secure medication storage, trained staff. It prevents a place from just being a shady landlord cramming vulnerable people into bunk beds. They have to prove they are utilizing evidence-based practices. We cannot achieve a recovery-ready Lexington by simply handing out cash to informal networks. It requires institutional rigor.
See, that institutional rigor is precisely what creates bottlenecks that cost lives. Let's look at what the city's own experts are finding on the ground right now.
You mean Carmen Combs Marks?
Yes, Carmen Combs Marks, the city's substance use disorder intervention program coordinator. She reported to the council that the absolute most significant barrier to accessing life-saving tools like Narcan isn't a lack of formal clinics, it is stigma.
Stigma is certainly a massive barrier, yeah. But how does bypassing formal clinics solve that?
Because when you force people to go through formal, highly visible institutional channels, like walking through the double doors of a building labeled substance abuse treatment, or checking into a heavily regulated NARR facility, the fear of being seen, the fear of judgment in their community, it keeps them away.
I see.
That is why the most effective harm reduction happens in non-traditional locations. We need to fund initiatives that put naloxone in barbershops, in gas stations, and coffee shops. Think of it like fire extinguishers.
Fire extinguishers?
Yeah. We don't force people to drive to the fire department when their kitchen is burning, right? We put the extinguisher right on the wall in their house. Harm reduction has to be treated the exact same way. Waiting for every grassroots initiative to achieve formal NARR compliance before they see a dime of settlement money is a luxury the dying just do not have.
Okay. I see the appeal of the fire extinguisher analogy. It's a good visual. But let's take that a step further. Without requiring strict NAR standards for recovery housing, aren't we risking taxpayer dollars on unregulated facilities that might actively exploit vulnerable populations?
Exploitation. The UKnowledge study explicitly points out that strict standards prevent things like patient brokering.
Patient brokering is a serious issue, yes. Nobody wants that.
Right. Where shady operators treat vulnerable people as literal cash cows for insurance payouts, or in this case, municipal grants. Strict standards ensure residents' safety. If a facility isn't offering proper MOUD support or isn't transparent about its certification, funneling public settlement dollars to them is a profound abdication of the city's fiduciary and moral responsibility. The money has to come with oversight. That is a very compelling argument on paper. But look at the alternative risk. Look at the risk of people like Trevor Davis sleeping on a floor because there are literally no beds available that meet these platinum-tier institutional standards.
I wouldn't call them platinum tier. It's basic safety.
I am not advocating for funding predatory facilities. I am advocating for lowering the barrier to entry for harm reduction. Even the UKnowledge study you reference notes that many facilities might provide excellent care, but they simply lack the administrative bandwidth to navigate the complex certification processes required by the state.
But they still need to meet the standard.
When we obsess over whether a facility has completed its bureaucratic paperwork to the satisfaction of the Opioid Abatement Commission, we lose sight of the primary goal: keeping the person alive today so they can seek treatment tomorrow.
But keeping people alive is exactly what the data shows the city's current structured approach is already achieving. We have to interpret the overdose data objectively. Lexington is significantly outpacing the state and national averages in overdose reduction.
We talked about this.
I know, but we saw a 30% statewide drop in Kentucky compared to about 20% nationally. And Fayette County itself saw that 43% decline from its peak. This proves that the city does not need to panic spend the settlement money. The targeted institutional approach is already working.
A 43% drop is a testament to the first responders. It doesn't mean the crisis is handled.
It means the mechanisms we are investing in are effective. Take the Empath Center at Eastern State Hospital, for example.
Right.
It is providing an actual alternative to emergency rooms for behavioral health crises. Think about how a standard ER treats an overdose or a crisis. It's bright lights, security guards, waiting for hours, and then often discharging the person right back to the street.
It's awful.
It is, but the Empath Center changes that model completely. It's a specialized, low-stimulation environment with immediate psychiatric care, totally bypassing the chaotic environment of a standard ER. That takes funding and serious planning. The quick response teams are following up with hundreds of individuals post-overdose. The system is humming, injecting millions of dollars chaotically into the system outside of a rigorous grant process could destabilize a strategy that is currently leading the nation in effectiveness.
Look, you are treating a 43% drop like a victory lap, while ignoring the baseline reality.
I'm not taking a victory lap.
Yes, going from 210 deaths to 120 deaths is a huge improvement, but 120 deaths a year is still horrifying. Let's put that in perspective for a second. If 120 people died in a plane crash at Blue Rass Airport every single year, Would the city council be sitting around talking about pacing our spending and putting the safety money in an interest-bearing account?
I mean,
Absolutely not. It would be an all-hands-on-deck immediate deployment of every available dollars.
but an addiction epidemic behaves fundamentally differently than a singular transportation disaster. You can't just,
But lethality doesn't behave differently. Furthermore, look at the toxicology reports from those deaths. Fentanyl is still present in 62% of overdose deaths statewide. Methamphetamine is in 51%. The drug supply hasn't fundamentally changed. It is just as lethal, if not more so.
I'm not disputing the lethality.
The people at the very margins of our society, the ones who cannot simply walk into a structured empath center, the ones who aren't completely sober and therefore are barred from traditional recovery housing, they are still fundamentally vulnerable. As Trevor Davis wrote, outside the health department, people looking for basic public health tools are often out of luck. The reduction in deaths is fantastic, but it is not an excuse for the city to hoard $9 million.
Okay, hoarding is a rhetorically powerful word, but it severely mischaracterizes the nature of public finance. Mayor Gorton specifically told the council, quote, "We don't want to sit here and save it all. I don't either."
But they are saving a huge chunk of it.
The proposal isn't just about an endowment. It sets aside $2 million for small and large grant programs and $2.2 million directly for supportive housing and treatment services. That is over $4 million allocated for active deployment right now.
Which still leaves millions sitting in an account.
By preserving $3 million in an interest-bearing account, the city is acknowledging a hard truth. The opioid epidemic is not an acute storm that will simply pass in a year or two. It is a chronic, generational public health shift. If we look at the demographic data from that UC Knowledge study, Fayette County has specific, deep-rooted vulnerabilities.
Like what?
Like population density issues, income disparities, and a severe lack of transportation access to recovery services. Fixing those deeply rooted issues requires long-term capital planning. You don't fix a chronic transportation gap by just handing out cash. You have to build the literal infrastructure.
But those community groups you are so hesitant to fund, they are the ones actually doing the work, while the institutional bureaucracy spins its wheels. Let's look at the timeline here. The Opioid Abatement Commission was convened in 2023.
Right.
It met monthly for 2 years. 2 years of meetings. And yet, at Tuesday's work session, council members like Whitney Elliott Baxter were still having to ask for specific dollar amounts and targets. The city claims it wants to fund supportive housing, but as Vocal KY has pointed out, we need spaces that keep people alive without punishing them for their choices. We need spaces that don't mandate absolute sobriety just to have a roof over their head.
Which circles right back to the difficulty of regulating low-barrier housing.
It's difficult, sure, but it is completely necessary. We need drug checking and syringe service programs expanded immediately. Every single month the city spends debating the exact percentage of yield on an endowment account is a month where the most vulnerable people in Lexington are left to rely on an underfunded, ad hoc safety net.
I hear that frustration.
At-large council member James Brown had the right idea. He said we should invest most of the money back into the community right now and then plan to save toward the endowment later. The balance of this proposal is entirely backward. You don't start drafting architectural plans for a hospital when people are actively bleeding out on the sidewalk.
Well, I think this really boils down to a philosophical difference in how we view crisis management. From my perspective, establishing a structured, accountable system is the only way to ensure that in 2035, when the national settlement payouts inevitably slow down, Lexington still has a functioning infrastructure to support recovery.
But 2035 is...
Just think about it. The city built an incredible, nation-leading response from a single coordinator position in 2018. That shows what deliberate, structured government action can do. The mayor's budget plan ensures that the $30 million will be a permanent foundation for a recovery-ready community, not just a temporary surge in funding that vanishes when the headlines fade.
And my perspective is that a permanent foundation in 2035 means absolutely nothing to the person who won't survive this weekend because they couldn't access low-barrier harm reduction. The moral imperative here is undeniable. We have the money right now. We know what works.
We do.
Putting resources directly into non-traditional locations, empowering people with lived experience, and fully funding grassroots outreach so they don't have to hire grant writers just to buy testing strips. The city must cut through its own red tape and deploy these resources to the neighborhoods that are suffering today.
Well, while we clearly diverge on the timeline and the mechanics of public spending, it is evident we share common ground on the ultimate goals for the city. Both of us, and indeed the entirety of the Urban County Council, agree on the critical need for expanded supportive housing and comprehensive wraparound services here in Fayette County.
Oh, we absolutely agree on that. Furthermore, there's no debate about the remarkable, life-saving work already being done by our local first responders, the community paramedicine team, and the community canvassers who are out there every single day.
Truly.
The folks on the ground doing the work are absolute heroes, and they deserve every resource we can give them to continue that work.
Absolutely. So, for our listeners here in Lexington, the decisions that will follow Tuesday's April 21 council work session are far more than just municipal bookkeeping. The choices made about how and when to deploy this $30 million won't just affect a spreadsheet at City Hall. They will intimately determine the survival, the recovery, and the future of our neighbors across the city.
It really comes down to the wire.
Is it more responsible to treat this as an acute emergency needing immediate triage, or a chronic societal shift requiring permanent infrastructure? We highly encourage you to stay engaged with the ongoing budget process. Look up the city's Opioid Abatement Commission reports, review the data and the UK Knowledge Study for yourselves, and form your own conclusions about how Lexington should proceed.
Because ultimately, whether that $9 million check stays locked in a drawer gathering interest or gets cashed today to build a safety net on our streets is a decision that belongs to this community.
Thank you for joining us for this rigorous exchange. Until next time, we invite you to keep exploring the complexities